Good morning and welcome. I am so excited to kick off the 6th Annual Symposium, MCHRI Symposium. As always, we will start with our land acknowledgement that Stanford sits on the ancestral land of the Muwekma Ohlone tribe. The land was and continues to be of great importance to the Ohlone people. Consistent with our values of community and inclusion, we have a responsibility to acknowledge, honor, and make visible the university's relationship to Native peoples. All right, so my name is Leonard. I'm chair of the Department of Pediatrics, physician-in-chief of Lucille Packard Children's Hospital, and have the great privilege of being the director of MCHRI. And welcome. I think today's symposium, and I really just we're so grateful to Tony Doerr on the Education Committee, and we'll make sure over the course of the day you'll see slides that acknowledge and celebrate the many people who made today possible. But what MCHRI's greatest strength is our ability to reach out and create connections across the entire university. We very intentionally are trying to sort of get our tentacles into every department, every school, institute, center on this campus and turn people's attention and get them thinking about the work that they do and the impact on maternal and child health. So we have these wonderful relationships with the institutes and the centers and the different schools. And you will see the one school that's not on here yet is the School of Sustainability, but we are going to get there. And today really is going to mark, I think is going to be a landmark day in creating a strong partnership with that school. As you look over the course of the agenda, you'll see all the things that MCHRI does so well and has to offer. So later this morning, we're going to hear about big data. We're going to talk about PedsNet, which is this extraordinary consortium across the country of merging of electronic medical records from 12 leading children's hospitals with nearly 10 million kids. MCHRI has very systematically gone through the process over a number of years to be part of that. You can imagine it's no small feat to convince Stanford University that we're going to send our EMR somewhere else, but we did it, and this is an incredible resource for all of our maternal and child health investigators. So later this morning, you'll hear not only about PedsNet, but many sort of large data sources that are already available here. We want to help our community use these resources and advance their research. So it's one of the things that MCHRI does around infrastructure and capacity and resources, and goes along with other things we do supporting the clinical research support, create the really innovative clinical research support office, the partnership we have with the quantitative sciences unit, the fact that we fund tuition for our fellows who want to get master's degrees in health services research or clinical epidemiology. So later this morning really showcases one of the many things that we do to support maternal and child health investigators. The other thing you'll see over the course of the day and later in the program is our rising stars. We're deeply invested in postdocs and junior faculty, and so we'll hear either through the posters or through the talks some of the really spectacular research being done by the next generation. And then it's another opportunity for us to bring in some of our more senior faculty, both in the School of Medicine but beyond, who are just doing spectacular research. And then really a very special part of today's event is we're going to celebrate a visionary leader, and this year it's Ann Arvin. I will mention, interestingly, the last 3 years, it's been 3 years in a row, it's been women, which has been nice. But then coming back to the creating connections, and that's really how we're going to kick off today as we think about tackling climate change. I think obstetricians and pediatricians are very socially conscious and advocacy-minded. Paul Wise, one of our faculty, famously said pediatricians are the ultimate witness to failed social policy. And I think when we think about climate, that's really relevant. And so we really believe here at MCHRI that maternal and child health researchers should be at the forefront of addressing social and environmental determinants of health that impact a child for life, starting from before they were born. And I hope people know that we have seed grants specifically looking at the impact of racism and social injustice and health disparities on child health. We know that the environment a child grows up in, the quality of the schools, the air that they breathe, the water they drink, and access to health care all have lifelong implications. And we also know that children are especially vulnerable to climate change, and I suspect you'll hear about that this morning. So each year when the Education Committee picks the keynote speaker, picks the topic, it's really a very unique opportunity to convene distinguished speakers that are tackling some of the greatest challenges and to bring people from the outside that are going to help us here at Stanford learn how to do that more effectively. And I will say at dinner last night with our 3 distinguished speakers from this morning's symposium, along with Dean Minor, leadership from our foundation, our hospital executives, and then so fortunate to have Jenna with us here today from the Sustainability School. Last night we really started the conversation about what do we need to do and how do we become leaders in this field. And so that's how we're going to kick off this morning with the whole session on climate. So with that, it's my great privilege to welcome Jenna Davis from the School of Sustainability, who we've learned her work is at the intersection of water and health. And before we do that, though, I need to tell you a little bit about MCHRI by the numbers. So MCHRI has given out more than $97 million in grants since we were created 14 years ago, 1,274 awards. We provide support through the Clinical Research Support Office for more than 200 studies. Our membership has grown to 1,270, and we are very proud. If you look at our annual report, you will see that we have membership from every single department, clinical and basic science, across the School of Medicine, as well as all of the schools across this campus. And we have what we call our sponsored partner programs. I'll just say those are as examples of what we're trying to do to insert ourselves. So looking at the Diabetes Research Center or the other institutes on campus or the Center for Innovation and Global Health, all those different entities, if they have seed grants that they're giving in their disciplines, we say, if you have one that's really compelling and really strong and relevant to maternal and child health, we'll fund it. And that sort of helps leverage, helps create greater capacity and greater connections. So our annual report has a lot more information. It's available on the website to learn more about MCHRI in general. But maybe I'll put this slide back up for Jenna to come to. Thank you and welcome.
Great, thank you very much for having me. I know some of you know a lot about the Doerr School, and some of you probably are saying, what is the Doerr School? So just at a high level, Stanford, a little more than a year ago, had a formal launch of the first new school that we've created at Stanford in 75 years, so it's a big deal. The Stanford Doerr School of the Sustainability, includes 9 departments, which span a range of disciplinary perspectives, everything from sort of geophysics and energy resources engineering to global environmental policy and environmental health behaviors. So I'm pretty jazzed about this. From my own perspective, I am jointly appointed between civil and environmental engineering. Our department also voted to become a joint department between schools of engineering and the Doerr School. And I also have a public health background. So I'm particularly excited about the possibilities that the Doerr School and School of Medicine will be able to find multiple ways to collaborate. A few other things about the school. It includes 3 institutes. The Stanford Woods Institute for the Environment is our oldest environmentally focused institute at Stanford. And it really was a model for the Doerr School. Some of you, I'm sure, have some familiarity, or maybe even, how many people have heard the Woods Institute for the Environment before today? Okay, that makes me feel really good. Then the Precourt Institute for Energy, and a third institute that is in the development stages now, which has the working title of Institute for Sustainable Societies. And I think this is going to be a particularly interesting point of connection, potentially, with the School of Medicine, because it really focuses on human behavior, policies and programs that can help support human well-being while also being part of the larger sustainability agenda. And finally, we have a sustainability accelerator, which really takes its inspiration from a lot of things that happen in School of Medicine around how do you scale proven solutions, right, to maximum impact. The tagline for the Doerr School is that we're looking to create a future in which humans and nature thrive together in concert and in perpetuity. And of course, I think most of us, when we think of the word thrive, right, health comes to mind immediately. It's, I think the real excitement for me is that we have great partnership from Dean Minor's office, from MCHRI, from other institutes, CIGH, that are interested in engaging in this conversation. And you have a lot of interest from the Doerr School in trying to figure out strategic investments we can make to help build that bridge to the School of Medicine. So I'll give you 2 examples of things that are actually underway. The first is we're moving forward to establish a center on human health and the environment, human planetary health, human ecosystem health. That whole naming debate is still underway. But that will be housed in the Woods Institute, which is now part of the Doerr School. And from sort of the other side, the way I see it is we've also launched a Healthy Planet, Healthy People initiative that is led by our colleagues in ecology, disease ecology, biology, right, which is really trying to think about the changes in land use, in the way we are interacting with our planet and the implications of that for human health. So coming from both sides, I think we're poised to have much more fruitful collaborations and thus much bigger impact. You know, when I think about kind of connecting the dots, this community and I think many peer institutions, when they're thinking about climate and health, they're really focused on connecting the dots between changes that we observe in the climate, in the natural world around us, and understanding the implications for human health. What I'm hoping is that with the establishment of the Doerr School is that we can actually connect the dots in the other direction as well, and I think this community could have a big role to play here because you are the trusted voices, right, for you have that interface with the public, with your patients, right, with communities that could really be leveraged here, right, to not only help care for them and help them understand the risks associated with climate change, but also to help communicate the ways in which we move in the world, the ways, the choices we make, the policies and programs we have, how that's affecting the health of the natural resource base on which all of our lives depend. So that's my ambition and my hope for a continued collaboration, and we really look forward to engaging. And I'm going to say that I'm going to seem very hypocritical because as soon as I wrap up right now, I have to dash out. And that doesn't mean that I'm not sincere about this. I will hope to come back in the afternoon and speak with more of you. But please reach out. We're looking forward to a long and fruitful partnership. Thank you very much.
Okay, great. Thank you so much, Jenna. That was very inspirational and also just a wonderful introduction to this morning. I want to welcome you again. I'm Tony Orr. I'm one of the co-directors for the MCHRI and also have the privilege of leading this amazing committee, the Education Committee, which chooses and puts on and organizes this symposium along with our amazing MCHRI staff. So first I want to thank this group for putting this on, for choosing this topic, which Jenna and also Mary both brought in today. I think it really is a big topic, and which I hope we can challenge and take on, which I know already from the intros from both people really set the stage. And so what I want to do is, so why do we do the symposium? This is the 6th annual one, as Mary's talked about. We've tried to choose every year impactful ways that we can develop a Stanford solution. And you can see the list here. Last year was community engaged research, which is really trying to bring the ivory tower into our partners in the community. And the next session really today is why do we choose climate change? And we've talked about that before. And that's because we know we basically, as you can see, focus really on maternal and child health individually as isolated units. In the Maternal and Child Health Institute, we try to work on that together. But then also, we look at social and behavioral determinants of health and how those work in the local environment, and then now environmental determinants and how those work together in the variables that happen, as we just heard about recently from Jenna. But then what we know is that there's climate change, which is the environmental determinants that is rapidly changing our environment. And so the question is, what are those changes, defining those, the environmental changes in the variables, and then, as Jenna mentioned, is how do those variables affect social behavioral determinants of health and also from maternal and child health, both from the environment in as well as from the social health and behavioral determinants out. And that's really what we're hoping to do and get at today, is what are the variables, what are the populations, and how can we exert change that make the biggest impact. We already know that maternal and child health really is at the nexus of the most vulnerable populations, so we can see changes rapidly. And so this might be really an important population to study to see the effects on environmental health. These are, as you'll hear about today, basic resources, infectious disease, challenging environmental conditions, and migratory populations are all part of this environmental change we have to deal with. And the question really is for today is, how do we measure that? And you'll see, as Mary Lynn mentioned, the pediatric network, which is the second session, is the top 12 pediatric hospitals in the country are banding together. So this is an amazing big data resource for environmental changes. We just have to basically find the measurements and put them into that group. So I invite everyone here to basically go hang out at the PedsNet table afterwards and try to figure out how to put that together with grants from MCHRI, which Mary mentioned. Also in the afternoon, we have, after the Rising Stars session, we have this Omics and Medicine session. And I'm a genomicist, and so I believe that precision health can be rapidly evaluated in terms of environmental influence. And so this afternoon session is a star-studded group of people that basically think about how to measure human health in very sensitive levels on a precision level. And so really, if you hang out with all three sessions, you should be able to put together an amazing set of environment, people, and measurements together. And so I look forward to today. Thank you all for coming. And so with that, I'll just start off the session and introduce our first speaker, who's Ari Bernstein. Ari's a Stanford undergrad. He's changed since then a little bit as a hum bio major, but now actually then went on to, for 20 years, to head the Chan Public Health School at Harvard's C-Change Institute, looking at environmental change and pediatric health at Boston Children's Hospital as a pediatrician. And so 3 months ago, he took this big leap to become the director at the Center for Disease Control and Prevention, the Center for Environmental Health. So actually becoming the highest ranking public health officer in charge of environmental health. So that's a huge lift for him. And so really today, we're so excited and honored to have him come and speak to us about climate progress measured in the lives of children. All right.